Thank you for choosing to view Family Advocacy Program's Services Saluting Our Veterans webinar presentation. My name is Sarah Gartner, and I am a social work intern for the Family Advocacy Program at Defense Logistics Agency Installation Operations Susquehanna in New Cumberland, Pennsylvania. Today, we will be talking about resources available to veterans and how to begin the process of accessing them. Let's get started. Navigating the Department of Veterans Affairs can prove to be confusing to those unfamiliar with the organizational workings of Veterans Affairs. For veterans, dependents, and survivors, it is important to have an understanding of the programs and services available from federal, state, and county Veterans Affairs offices. This presentation is designed to provide a breakdown of the VA system, not to replace the qualified representatives who can share further information regarding services available to veterans and how to access them. The Department of Veterans Affairs is a comprehensive system of assistance to veterans of the United States Armed Forces. Their goal is to provide veterans with benefits and services to which they are entitled. These could include education opportunities, rehabilitation services, compensation for disability or death related to military service, home loan guarantees, pensions, burials, or health care. Before we begin discussing the information on this slide, I would like to clarify that at any point you see the acronym VA throughout the presentation, it refers to the Department of Veterans Affairs. Veterans of the United States Uniformed Services may be eligible for a broad range of programs and services provided by the VA. Eligibility for most VA benefits is based upon discharge from active military service under other than dishonorable conditions. The term service member means a member of the uniformed services consisting of the Armed Forces, Army, Navy, Air Force, Marine Corps, and Coast Guard, the Commissioned Corps of the National Oceanic and Atmospheric Administration, NOAA, and the Commissioned Corps of the Public Health Services. National Guard and Reserve members with active service may qualify for a variety of VA benefits. Additionally, traditional and technician National Guard and Reserve members who typically serve 1 weekend a month and 2 weeks a year are eligible for some VA benefits. Additionally, the VA also offers services to support caregivers, dependents, and survivors. There are 3 main sub-organizations of the VA. The VA operates Veterans Benefits Administration, Veterans Health Care Administration, and the National Cemetery Administration. The names of these organizations alone provide a glimpse into their area of service, but we will look at each sub-organization specifically as well. The Veterans Benefits Administration, VBA, is one of the 3 main subdivisions for the Department of Veterans Affairs. The VBA provides a variety of benefits and services to veterans and their families and is responsible for administering the department's programs that provide financial and other forms of assistance to veterans, their dependents, and survivors. VBA oversees the initial registration of veterans, determining eligibility, and the following lines of business: home loan guarantee, insurance, vocational rehabilitation and employment, education, i.e. the GI Bill, and compensation and pension, among others. The major program offices within VBA are listed here: Compensation Service, Pension Service, Insurance Service, Benefits Assistance Service, Education Service, Loan Guarantee Service, Vocational Rehabilitation and Employment Service, Employment and Economic Impact, Office of Field Operations, Records Management Center, Appeals Management Center, Office of Business Process Integration, and the Veterans Benefit Management System Program Office. To break it down further, the compensation and pension programs include the following: disability compensation, dependency and indemnity compensation, pension programs, burial and interment allowances, children of women Vietnam veterans born with certain defects, and Veterans Compensation Cost of Living Adjustment Act of 2014. Education benefits include the Post-Vietnam Era Veterans Educational Assistance Program, the Montgomery GI Bill, Reservist Educational Assistance Program, National Call to Service, Dependents Educational Assistance Program, and the Post 9/11 Education Assistance Program. Insurance Programs offers 4 life insurance programs for veterans: Service Members Group Life Insurance, Family Service Members Group Life, Veterans Group Life Insurance, Service Disabled Veterans Insurance. Vocational rehabilitation and employment services authorized through the VA include comprehensive rehabilitation evaluation, vocational counseling and rehabilitation planning for employment services such as job training, job seeking skills, resume development, and other work readiness assistance finding and keeping a job, including the use of special employer incentives and job accommodations, post-secondary training at a college, vocational, technical, or business school, and supportive rehabilitation services, including case management, counseling, and medical referrals. The Veterans Health Administration, VHA, is another of the 3 main subdivisions for the Department of Veterans Affairs. VHA is the largest integrated healthcare system in the United States. It operates through 1,243 healthcare facilities to over 9 million veterans. A distinctive of VHA includes its 170 VA medical centers and 1,063 outpatient sites of care. Services provided by VHA include its most common traditional hospital-based services provided by medical centers. Some of these services are listed on the presentation here. The traditional hospital-based services provided by medical centers include surgery, critical care, mental health, orthopedics, pharmacy, radiology and physical therapy, as well as audiology and speech pathology, dermatology, dental, geriatrics, neurology, oncology, podiatry, prosthetics, urology, and vision care. Advanced services include organ transplants and plastic surgery. Outpatient community clinics provide primary medical care, occupational therapy, physical therapy, and podiatry as well, and some other services. Patient advocates are another resource available to veterans through the Veterans Health Administration. At every medical center, patient advocates offer help resolving concerns about the healthcare experience. Veterans are able to bring questions, concerns, problems, or special needs to the patient advocate, who then refers to the appropriate staff for resolution. Eligibility for services offered through the Veterans Health Administration is the same basic eligibility as the Department of Veterans Affairs. Active duty eligibility for VA healthcare involves serving 24 continuous months or the full period for which the veteran was called to active duty. An additional step for accessing VA healthcare is to apply for enrollment. Form 1010-EZ is the application for enrollment form. Form 1010-EZ can be found by going to the va.gov website, utilizing the search option, and simply typing 1010-EZ. After filling out the application, veterans can submit it online. If printing the form out, mail it in to your nearest medical center instead of the Atlanta, Georgia address listed on the form, as this will allow for more efficient processing. Additional methods of completing the application include calling 1-877-222-8387. County VA offices are also available to help complete applications. The National Cemetery Administration, NCA, coordinates burial for members of the armed forces and veterans who meet minimum active duty service requirements and were discharged under conditions other than dishonorable. The VA provides the gravesite, grave liner, opening and closing of the grave, government headstone or marker, U.S. burial flag, presidential memorial certificate, and perpetual care of the gravesite at no cost to the family. VA operates 135 national cemeteries and 33 soldiers' lots and monument sites in 40 states and Puerto Rico. Even for veterans not buried in a VA national cemetery, VA can still provide headstones, markers, or medallions to commemorate their service. Additionally, the National Cemetery Administration maintains the nationwide gravesite locator, which is used to find burial locations of American military veterans. In addition to veterans, spouses may also be eligible for burial with service members. Burial in a national cemetery is available to those veterans who met minimum active duty service requirements and received a discharge other than dishonorable. Burial options are based upon specific cemetery availability and could include in-ground casket, interment of cremated remains in a columbarium, in-ground or in a scattering area. More information regarding the burial options can all be found at www.cem.va.gov. An important service that the National Cemetery Administration offers is also the predetermination for burial. So you can actually, prior to passing on, you and your family can see what options are available to you through the National Cemetery Administration. And again, this information would just be found through the NCA's website on the VA's website. Another important distinction to make to understand services available for veterans is just the overall organization. There are programs offered through the Department of Veterans Affairs, which is the federal level and has been the focus of our presentation to this point. The Pennsylvania Department of Military and Veterans Affairs coordinates state-level programs and services. In addition, there are also individual county offices which primarily serve to connect veterans with the Pennsylvania and federal benefits and programs, those services. At a state level, the Pennsylvania Department of Military and Veterans Affairs coordinates resources for veterans. Benefits and services for veterans and their beneficiaries in Pennsylvania include the Disabled Veterans Real Estate Tax Exemption, Veterans Temporary Assistance, the Blind Veterans Pension, Amputee and Paralyzed Veterans Pension, Educational Gratuity, Persian Gulf Conflict Veterans Bonus, State-Run Veterans Homes, the Pennsylvania Veterans Trust Fund, and Military Family Relief Assistance Program. To see about any of these resources, contact the closest field office to you. They're listed on the slide here, Philadelphia or Pittsburgh. County Directors of Veterans Affairs provide county veterans and their dependents direct assistance to identify, determine eligibility, and assist in the preparation of applications for county, state, and federal veterans benefits and programs. County VA offices offer connections to resources, assistance completing VA applications, including the Health Administration, Benefits Administration, or the National Cemetery Administration at the national, state, or county level, and other services. The county offices are based on the current county of residence. The county director is responsible for the payment of burial allowances and ensuring grave markers and headstones are properly requested and placed for each deceased county veteran. They also provide direct application for state programs like the Real Estate Tax Exemption, Veterans Emergency Assistance, Blind and Paralyzed Pensions, and Education Gratuity for veterans who are currently rated at 100% permanent and total by the Federal Veterans Administration. County offices are a great local resource for veterans requiring in-person assistance accessing VA programs and services at the various levels they are offered. For many resources, it is required that veterans first prove their status as a recognized veteran through the Department of Veterans Affairs. So first, I would recommend seeking out the county VA offices to receive assistance in accessing all the VA-related benefits through application help, as well as easy connection to local resources. Utilize the county VA offices for maximum receipt of information regarding services. You can see on the slide here the contact information for New Cumberland's 3 surrounding counties. So we have Cumberland County, Dauphin County, and York County. They all have physical locations, and I've just included here links to their direct websites as well as phone numbers, so you could just call as well. Finally, I just wanted to share some other resources in our local area which are listed on the slide. There are housing services, supportive services for veterans and families, veterans centers, veterans membership groups, and employment programs for veterans. If you are seeking mental or emotional health counseling, local veteran centers and the VA healthcare system have resources for you. If you are seeking confidential help for you or your family, contact the Veterans Crisis Line at 1-800-273-8255 and press 1. For more information about any of the services listed on the slide, please contact the Family Advocacy Program to gain access to our full Veterans Guidebook. Thank you for your time today. I hope this presentation has been helpful. If you are interested in understanding or following up on anything regarding the resources available for veterans, please contact the Family Advocacy Program Manager at 717-770-7066. They will be available to answer questions or to forward the Veterans Guidebook directly to you for resources. Thank you for your service.